Fine?
Yep.
Okay. Well, thank you all for coming today. I think you've already received my written briefing, and the video will be online, of course, momentarily. But I think we can share some good news. First of all, there's some very small things that the city can try to do to improve the lot for our downtown businesses. As you know, our social distancing really requires us to be in public as parts of families and households rather than having different households converge. But we do welcome people in families and households to use the picnic tables around the city. The good weather's starting to come this weekend, so people can go out within a family and get some takeout and then enjoy a park. We'd really encourage that. And we'll do whatever we can to try to ease the pain of some of the local businesses. Obviously, the city's in no position at all to simply give money to local businesses. We don't have enough money to even pay for our own bills. But anything we can do to try to help them out. With the closing of the library on the same weekend, we started doing our social distancing. That was around March 12th now, about 6 or 7 weeks ago. There's been no place for people to use the internet. So we're making our public internet at City Hall available. But of course, City Hall is locked most all the time. So we're going to move a couple of benches up underneath the overhang in City Hall so people can at least come up at 24 hours a day and use that dry area. And as weather permits, that will be a little bit nicer for people as well. So these are just small things that we can try to do, knowing that they're really not significant compared to the level of suffering out there. But I'm really proud of our city. As I mentioned, we've been doing this for now about 7 weeks. So 7 weeks ago today that we all met down by the new arts park and talked about this for the very first time. Talked about our social distancing, talked about our 6-foot guideline for social distancing and working from home, staying safe at home. Talked about hardening our nursing homes and our rec center, our crate center being closed, library being closed. And that was all actually well before anybody else in the state was doing those things. And because of that, I'm really proud that we've got one of the lowest infection rates in the state. We've moved from the worst third of all counties to the best quarter of all counties, and that's a real dramatic change. I calculate a couple of different ways that I think our infection rate in Clinton County is somewhere around 1%. And you've been hearing about the 25% infection rate down in New York City, for instance. That's a huge change. And what that does, and by the way, I might add to that, there's been only 2 new reported positive cases in the region in Clinton County in the last 4 days. So that's really good too. What we have moved from is, instead of the disease managing us, we're now starting to manage the disease. And I don't want people to get all complacent for 1 second. That doesn't mean our challenges are solved. It means that what we're doing now, if we keep it up, we can continue to manage this virus, presumably until we have treatments and vaccines. That's really our goal now, is to get to the point of treatment and vaccines without any more deaths and with few more infections. And I think that the city of Plattsburgh and our region are doing an absolutely incredible job, probably better than just about any other, as far as I can see in the state, in really doing such a thorough job. And people are being very conscientious. I'm wearing my mask. You all are wearing your masks. Everybody I come across on the street, except for a few young people, are wearing their masks. This is fantastic, and it's really starting to pay off, and I'm really, really grateful for it. I'm also really grateful to the tremendous healthcare experts that are sharing information with us. I'm doing a proclamation today to thank Dr. Keith Collins, the infectious disease specialist at CVPH, and Aaron Strife and John Canosa, who've been absolutely working 24 hours a day to try to keep us safe as our public health experts on behalf of the county. Not only do they prepare us for all this, and they help with the quarantines that are so necessary to protect our elderly and vulnerable population, but they're also keeping us informed. And I really sincerely believe that the more information the public can have, the better decisions we're going to make. And I really appreciate their work, especially when I see Dr. Collins on his weekly Facebook Live show. You know, he tells it like it is. He gives us the information we need to know. And I don't find people are panicking over that information. They're saying, okay, now I understand why this is serious. Now I understand what I need to do to keep my neighbors safe. I need to understand why it's such a great thing that we're down to 1% infection rate or so. And I now understand why we need to keep all that up. That's what good information does, I believe. And he and his colleagues are doing just a wonderful job for that. We need to, though, keep all of our social distancing going. And as you know, in all city facilities, we've been doing social distancing now for 7 weeks. And that's obviously making a difference. We've also been doing some social distancing for some of the properties we control. For instance, we've closed the Crate and the rec center and all those sorts of things, et cetera. And we'll evaluate those as conditions change, certainly. Now, we're also asking other groups to do that as well. And as you know, groups like the museums have canceled their programs for 2020. And the Battle of Plattsburgh Association, a community-based group, canceled its event for 2020 and asked us instead, let's have a great event in 2021. Now, the city's not going to dictate to what the decisions for these private groups, and some of them are waiting a little while longer before they make their decisions on street drives and et cetera. And if they can do all these things in a way that's consistent with social distancing, the best practices at that time, we're not going to discourage that. It's not up to us to second guess. All our job is to apply the best practices. So we're not going to make decisions for other groups, but we also see a lot of evidence that those other groups are behaving incredibly responsibly in doing the right thing already. And that's all we can ask, and I very much appreciate it. And I'm sure the governor or the Common Council, perhaps, as conditions change, will be either relaxing or perhaps strengthening, if there is a second wave, some of these premises in the future. You know, I think the governor said it right. He said about reopening. He says, I'm not going to trade off economics for life and death. If you have your health, you can figure out anything else. If you don't have your health, nothing else matters. So we need to be really smart as we reopen. And I think we've demonstrated we're capable of doing that. So I mentioned Clinton County Health Department now reports 64 positive cases. That's just one more in the last day and only 2 more in the last 4 days. At this point, there's only 12 active cases in the county of county residents. What a huge turnaround. Works out to the only 8.8 people per 1,000 of population, which is less than half of what Glens Falls has, what Watertown has, what St. Lawrence County have. So we need to get that testing up, but you also now heard that they're doing some testing, drive-up testing at the hospital, and they're also, since we talked last, the governor's talked about using the vast network of 5,000 independent pharmacies to start doing testing there. He's already begun that by Saturday in 5 counties. We're not one of those 5 counties yet. We're also not one of the 5 counties that's allowed to take on additional patients at the hospital for elective surgeries yet. But I'm sure we'll be one of those counties very soon, and that's really exciting. Obviously, it's something that's been very important for people. The state of New York is still the hot spot around the entire world. As you've probably been reading, the U.S. Cases have now exceeded the million person mark, as we predicted last week, and has now more than almost 62,000 deaths at this moment. And as you recall, the White House was talking about an estimate of 60,000 deaths in total. We've already surpassed that, obviously. We've got a ways to go. They've upped their limit to first 67, I think most recently 72, but I estimate we're going to blow through that within the next week or so as well. So obviously, some areas of the country, they're starting to reduce their load, like we're starting to see in New York State. But other areas of the country are still increasing. Ohio's in the increase. Indiana, Kentucky are all on the increase as well. So we obviously need to maintain vigilance, because it's not all about one region. When we live in the United States, where people can freely travel, any state's disease is every state's disease eventually. So we need to continue to keep working on that. And as you've also been reading, the world is now over 3 million cases with about 229,000 deaths this morning. So we're going to continue on with this. But one more parallel, by the way, I'd like to establish between Dr. Collins. I call him our local Dr. Fauci. He tells it like it is, because it's really good advice, and I really appreciate what he's doing for us. And then tonight, besides my proclamation thanking some of our real frontline healthcare workers and experts and their staff, obviously every night is budget night for us. We've heard more news from New York about pending cuts. As you may know, one of the biggest sources of revenues for a city is something called aid and incentives to municipalities. Already in the governor's budget, even before COVID-19 came along, he talked about a decrease in AIM, essentially reducing to about zero all the AIM that goes to villages and towns. And we've got a former mayor from a village here. Villages and towns are receiving little or no AIM anymore. Cities still rely upon that as just about tied for our second largest revenue source in our general fund, a very important component of our general fund. And they're now talking about cutbacks to AIM in the order of 20% or so. When we did our initial modeling, we were still hoping it would be 10%. Of course, since then, the governor has released a revision to his budget, estimating a shortfall of $10 to $15 billion this year, and $60 to $64 billion, if I recall, over the next 4 years. So he obviously expects budget's going to worsen. And he says one of the only places I can pay for it is out of transfers to other entities like AIM. So we're starting to revise our budget knowing that it could get worse unless it gets better through some sort of act of Congress. But we also start to see all the wranglings in Congress right now. One group wants to provide aid to states and localities. Another group figures that states and localities, if they haven't been spending their money wisely, they should just go bankrupt. And to me, bankruptcy is absolutely not an option. We're going to continue to work hard to save the city because we believe there's a real value proposition here in the services we provide, and the first responders doing such a great job right now in the coronavirus crisis, and in the very inexpensive electricity that would be lost if we lost our franchise. So we're working incredibly hard under the assumption that we need to save this city. I think somebody wrote in the paper earlier today that yeah, save the city, but don't do it on the backs of taxpayers or employees. Well, you know, I don't know who else there is to save the city if it's not taxpayers who pay for the city or employees who we pay expenses to for the city. And obviously, we had to make some very difficult choices recently with regard to furloughs. I can report to you, I think a lot of the reports that we were laying off 62 workers was really misguided, not very helpful. The list was never more than about 24 employees that would be affected. Of those 24 employees, 80% of them were offered furloughs. So they receive all their health benefits. As a matter of fact, many of them make more on a furlough than they were working for the city because of the $600 subsidy that the federal government is providing to them. So we ended up with about 25 furloughs or layoffs, of which 80% of them were furloughs. And then the other layoffs were also trying to figure out ways to bring those employees back in some other way in the future. The only reason we had to do layoffs in that case instead of furloughs in 20% of the cases was because a condition of a furlough is we have to have some sort of date certain when they can return. And because of the various departments that they represent, or one department they represent, we just didn't have any sort of guarantees right now on their return. But we are working hard to find other places of employment in the city for them when we can bring them back. So we believe everybody will be taken care of in the end. But obviously our work is not at all over yet. We're going to have an awful lot of very difficult budget work. We've decided every single meeting we're going to devote half an hour, our work session, instead to budget discussions from here on in. And beginning tonight, and I really appreciate the chairman of the finance committee and his other colleague who are here today to answer any questions you may have on that as well. But that's going to be an ongoing discussion that we need to work on every single day, every single week from here on in. But I'm confident we can do something to really save the city and save the livelihood for the employees, because ultimately if the city goes down, so do the employees, and we're not going to let that happen. It's going to be very difficult. We're going to need to make some difficult choices, obviously, and we already have. And we'll remain hopeful about funding from the federal government. But in the meantime, we're going to make some very hard decisions that take an awful lot of courage, and I very much appreciate the help of the council in doing that. So I think that's all my scheduled comments. Is there any questions that you might have for today?
The governor has said that he is looking into, the phased, bringing back industry and things like that in a phase in.
Mm-hmm.
And I know that you're part of the task force that the county is going to be looking at that. A lot of the manufacturing industry is outside of the center city area. how do you see a phased-in return to business affecting the city?
Very good question. First of all, the health of anybody in the region is really the health of everybody in the region. I mean, we wear masks, not because I'm trying to protect myself, I'm trying to protect you in the room as well. So it doesn't matter where the infections occur, whether they're in a manufacturing site in the town of Plattsburgh, it still affects the city. So we really have a great concern, because this is where we have 600 times the population density within the city compared to the rest of the county. Somebody may work in a enterprise in the town, but when they come into the city for some of their services, etc., then they're in that high congestion area where viruses obviously develop and spread. If you look at a map of where the viruses are spreading within the country, it's not hard to predict where they are. They're in the Chicagos and the New Orleans and the New York Cities and the Washingtons and the LAs and the San Franciscos and the Seattles, right? They're all in all the major urban areas. Of course, because that just makes sense. Doesn't mean everybody lives there. It means everybody's really much more congested in those areas. So we all are all for one and one for all on the infection side. And I believe that manufacturers can figure out a good protocol to keep us safe. It's going to require changes, obviously, in the way they do it. It might require shifts being spread into 3 shifts instead of 1 shift. 1/3 of the people on 3 shifts instead of everybody on 1 shift. So that's some of the things that we tried in the city very early on under our social distancing 7 weeks ago. And it's going to require an awful lot of testing, because we need to know that people are coming to work uninfected before they can come to work, and the governor has already stated that. It has to be tied to much, much more extensive testing than we're doing today. So then the other side of it, if the manufacturers really aren't in the city, do we have any other link besides just their concerns are also our concerns? Well, yeah, we do. We need to also bring our businesses up to speed. And a lot of the small businesses are really the lifeblood of this entire community. There are our arts and our entertainment and our culture and our service industries that primarily are actually in the city, and we need to bring them up to speed and figure out ways for them to be able to follow protocols that keep them safe. And that's why we're, for instance, putting picnic tables all around downtown, because we know people are coming to get takeout to these establishments. We need to then figure out ways for them to also be able to consume these services safely as well. So that's something the city can do to contribute to this mix as well. And then finally, as you know, I've got a very strong concern over the health of our residents. That's probably my paramount concern, as the quotes I made today, that basically if we don't have our health, we don't have anything. So if we're going to do something collectively, and we know that there's an increased responsibility on our city residents because of the congestion here and because of how many times people cross paths here compared to anywhere else, that's an added reason why the city really needs to have a voice, so we can amplify that to our residents and tell them the extraordinary measures that we really need them to keep up with, even if they are still in one of those industries that are staying at home. We still all got a responsibility.
Well, which kinds of businesses, which sectors in the city would you see being able to open up first? Even if it's, a few people at a time going back to work. I mean, within the city, which business sectors do you see being able to open first?
Certainly Bombardier and Moldrite have been continuing. Their largest employers. GP has been continuing. CVPH has been continuing. Obviously, we need them to continue. I know that SUNY Plattsburgh, another one of our very largest employers, is setting up all kinds of proper protocols. So, and the government has been running throughout. Most of the things the city does are actually essential services. We analyzed, when we did our budget cuts, our primary goal was to figure out who our most essential workers are in what services, and it turned out that 9 out of our 10 departments were essential in one way or another. Not gratuitously essential, but absolutely essential, and that if they weren't doing their job, we could not do the essential road building or road repair, water and sewer repair, police and fire. So government is pretty much essential. County government had obviously a lot more leeway to lay off or furlough, 6 or 8 times more people than we did, because they do a number of services that are probably not as directly related to water and sewer and infrastructure as we do. So they have more leeway there, but they've been continuing to provide those services as well. So what else is there? Well, it's the financial services, the banking, the restaurants, etc. And banking has continued on. Financial services is now being done a lot more through Zoom rather than in person. So the biggest concern at this point now remains the kind of mom and pops on Main Street and how they can do it. Now, some of them are retail. So we've seen good protocols for retail. You only let a few people in the store at a certain time, and flow through, and aisles going one direction and the other direction instead of two ways, et cetera. So there's ways to do retail that can be safe. And then that really only leaves things that might have large public gatherings, like culture, entertainment, and restaurants. Restaurants, the protocol that the governor's talking about is maybe 50% capacity or 25% capacity, only every second table, every fourth table occupied. He's talking about no fixed menus, instead a paper menu that's brought to you and then disposed of afterwards. No condiments on the table, etc. So they're already producing protocols for that. And then so that really leaves the kind of events and large gathering space kinds of activities like bars and concerts and all that sort of stuff. And I think the governor's pretty clear that we're just gonna have to figure out a way to do those attractive industries somewhat differently. We can't have activities where we're bringing lots of people in all to one pretty tight space from all kinds of different locations and send them all back out again. He talks about the legal term attractive nuisance. We can't be doing attractive kinds of industries until we're absolutely sure that the infection, not only here but anywhere else, is also gone, because if we have an event at the Strand and it's bringing people in from Burlington and Burlington still has infections, well, now Clinton County is reinfected. So we're going to have to be very smart about these sorts of things like parades and beaches and sports events and cultural events. And as you've been hearing the governor, he's developing a plan for that. And I applaud him to have that courage to look at it on a regional basis. So I think those are the avenues for where the city's really interested and involved.
The parades have all been canceled though for the year, right?
We canceled the July 4th parade. And then the Battle of Plattsburgh, of course, canceled their Battle of Plattsburgh gathering, which had a component of a parade as well. We just did not see, for two reasons. First of all, we did not see by July 4th, I'm speaking of the council here, but they can speak for themselves, that it's possible to figure out all the social distancing necessary for a parade, and all you've seen the throngs of people who line the streets for those sorts of events from all over the county, three-county area, really. And second of all, for the parade and the vendors and the music that we put on, none of the bands or the vendors or the parade participants were willing to commit. And I understand, bands aren't on tour right now because nobody's going to music halls anymore. So we just were not able to put those resources together. I think the council's facing the same challenge with the beach. Normally, we do lifeguard school in the spring to train the kids in high school, up the seniors in high school, to act as our lifeguards. Well, first of all, there's no high school right now. It's distance delivered, and I don't think you can really teach lifeguard skills on the internet right now. And the pools are closed, so we don't have the stock of people to staff the beach. And even if we did, we'd have two other problems. We need way more people to staff the beach because of social distancing. The Department of Health said already expect to have much higher stringent requirements for beach openings because you have to keep everybody safe. And second of all, we're not going to have the Quebec visitors coming down across the border to come to our beach this summer. So it'd be very difficult to staff those things. So those are the things I was talking about that the city controls that we probably won't be able to put on, although they did include in their resolution they would reconsider that if conditions change and the budget changes, et cetera. But that doesn't mean if some group wants to use one of our facilities, if they can figure out a way to do it in a safe manner, like a street drive, et cetera, if they can do it in a safe manner, it's not up to us to decide those sorts of things for them.
So for now, is it unlikely the beach will open this year?
From what we know now and our problems with staffing the beach at this point and the closure of the border, I think all those things would have to change dramatically for the beach to be able to be open. But it's not a zero probability. I think that there's still hope among some councilors that we can figure out a window of opportunity to do that in the summer.
Can you talk about the proposal to open up the farmer's market, when it's expected, what it entails, how it's going to work?
there's another example as a separate organization that we provide a venue for, but it's their call. There are protocols that Ag and Markets has provided to the farmers market, and the farmers market believes that they can fit into those protocols to be able to open. They've had to adjust the way they're going to do business somewhat, but they're confident they can do that. And again, that's their call, so long as they're following all the required practices of the city and the governor's office. We encourage that sort of thing. And remember, they're also an essential service industry as well. They're providing for fresh food for our residents too.
So are they gonna be opening on the 30th? Is that gonna be?
Of May, I believe so. I believe that's the date they're still aiming for.
And, the Russell Brand apartments, they're set to reopen or come out of quarantine soon. Can you talk about how that process
Yeah.
works?
Both apartments, Lakeview and Russell Barnard, are coming out of quarantine. And that's really, really good news. There's a 2-week quarantine for both, and doesn't mean we need to let our guard down with that. We had a big scare about another elderly building earlier this week, but I don't think it turned out to be a positive case there. And just this afternoon it was reported that there's been a positive case at Meadowbrook, which is another big concern for us. As you know, the city of Plattsburgh really houses most all the elderly facilities for the region. And one of my concerns in the case of Meadowbrook, it was a staffer, not an employee or not a resident. So we're just hoping that none of the residents have become infected yet or infected. But one of my concerns, as I talked about last week, is people who work on one nursing facility that may be infected, and then also work at another nursing facility, and they're bringing those infections into the nursing facility. That's the vulnerability of the nursing facilities. If you could keep that population locked down, they're going to be safe. But if people are moving in and out of those facilities, that's where the disease is coming in. So that gives me great pause for concern, because obviously that population is by far and away the most vulnerable.
So are they gonna be tested or anything before the quarantine's lifted, or is it just gonna be lifted and go back to normal, or?
Well, you know, since we talked last, I've been calling for a relaxation of the testing protocol. The testing protocol had been, because of a shortage of tests, the hospital had been using tests only for triage for the people who are coming to the hospital, so they can figure out which ward you're going to go to. Are you COVID positive or not? And since then, since we talked last, they've relaxed that, and they're actually having a drive-in clinic that anybody who is showing symptoms or have a doctor's order can be tested now. And presumably they have enough tests now to also prescriptively go and test people like at the nursing homes. If you were in a nursing home in quarantine, they didn't test you before because they said, well, you're going to be here for 14 days anyway. Why use a test up on you? But I have heard that the hospital now has 12 or 1,300 new tests. There's only been about, I think, 500 tests administered in the entire county up till now. So they've got way more tests than we used to. And we're now going to be seeing tests through our pharmacies, et cetera, as the governor promised sometime in the future. So I'm really hoping that we can start doing just as you said. When there's a building that's quarantined, or if there's a threat at one of our buildings, go in and test everybody right off the bat, and then test everybody who's coming into that building on an ongoing basis. When we talk about bringing back workers, one of the protocols is test every worker as they come to work every day. Obviously, we're going to need a huge expansion of testing capabilities for that, but that's what all the public health experts say we're going to need to do if we're going to bring back these essential industries and other manufacturing construction industries really soon.
Would you suggest that be the case for Meadowbrook now, to try to stop the spread?
If I was allocating tests, I'm no public health expert, and if we had certainly had enough tests, yeah, obviously, that's what I would do. But I'd rather hear from a public health expert. I know the public health experts want to do more testing. I mean, they've told me so. You've probably all heard that as well. It's just there's a shortage of tests, so they've been rationed up to now. But we've had of any county in the state that has more than one death, we've got the lowest testing rate in the state right now. We'd have to increase our testing rate by many, many factors. I think a factor of 5 just to get to the average upstate testing rate. So we've got a lot of ways to go to catch up on testing. We just haven't had the test kits available in our county to do so. So as soon as that's freed up, I think we need to start catching up. And you've all been hearing also about 2 types of tests. One is the diagnostic test that tells you if you are currently infected. And the other is the serum test that tells you if you've got the antibodies where you may have been infected in the past. When I talk about the 1% infection rate, that's not an actual number of people tested and positive. That number is only, 64 in our entire county, 64 positive tests in our entire county. That's less than, 0.1% of our population. When I say 1% of the population, that's based on the governor's testing and based on the antibody serum, where people that probably have had the disease, or at least have antibodies to the disease, and that means that probably about 8 or 9 out of 10 people who had the disease didn't even really know it, didn't have severe enough symptoms to need to go and get a test. So that's the hidden part of this disease. We need to really do more of both of those tests in the future. And some of these antibody tests are not particularly are reliable yet, and you've been seeing the national debate on reliability of antibody testing. And they're certainly not very available yet, although they're becoming more available. And then finally, it's not even clear whether antibodies necessarily give you a long-term immunity yet. So why we need to keep working on this is we've only got really a 1% infection rate in the county. That means that 99% of us are still vulnerable, even if that 1% is immune and the jury's still out on that. So if we're 99% vulnerable, we need to keep doing all the stuff we're doing right now and have been doing back for the last 7 weeks when there was very few positive tests. We started rolling this stuff out when we were just having the first 1 or 2 positives in our region. And if we were worried 7 weeks ago because we had 1 or 2 positives and we were 100% vulnerable, we should be equally worried today when we've still got a dozen cases out there that we know of, and probably many, many more that we don't know of, and we're still 99% vulnerable. So we just can't be complacent. We just need to keep working hard, doing best practices until we know there's some sort of treatment or vaccine.
To switch topics a little bit, so you were talking about putting up the picnic tables around town. I'm just curious, do you know how many picnic tables and also where are these tables coming from? You mentioned a little bit of a lull in the budget, so where are they coming from?
We already have a couple of dozen picnic tables. We put them out in the summer. Again, we're asking for not people to congregate at picnic tables. We're talking about families to go there, go and pick up some meals. And they're situated around where the various downtown restaurants are. And we'll look for other restaurants in the city and try to give them the same sort of facilities as well. Because we know inevitably this can be a really nice weekend. It's going to be sunny and 60 degrees this weekend. People are going to want to be outside. So let's make it easy. And by the way, one of the other things we heard from researchers this last week or so is that UV rays will kill the coronavirus in about an hour or so. That's a good sign that with the sun coming out now, and we have also going to increase the cleaning protocol on our tables to do that regularly as well. But again, as long as only families go to these picnic tables or people in the same household, they've already been reinfecting each other. So we're really trying to make sure this isn't a place to congregate. This is a way for families to enjoy a gathering, but try to be very, very careful in the process.
We'll just throw in more. You talked about the hospitals. Obviously, they're in dire financial situation, much the same as the city. Has the hospital been able to share with you why with such a low infection rate, CBDH is not going to be able to start up elective surgery with some of these other hospitals immediately?
No, I haven't heard, but as you correctly stated, 35 counties are now open for elective surgery, and that means that there's 27 counties that aren't, and we're still one of those counties that aren't. From what the governor was saying in his press conference today, what I believe he's addressing is a criteria for how much surge capacity that an ICU or a hospital would have. I think our hospital has quite a bit of capacity outside of the ICU wards, but their ICU ward is still full up enough that if they need to go up another 50% or so, they just wouldn't have that surplus quite yet. So I think that part is holding back the entire hospital. I'm hopeful though that can be remedied very quickly and our hospital will be back on the list, because you're right, at this point, I don't know the furlough or layoffs that have occurred in the hospital here, but I know Glens Falls Hospital had 320 layoffs, and that's really severe. And then you add that to the 180 or so people that were laid off from our county buildings, for instance. Now you got 500 people potentially in the city if Glens Falls and our hospital are similar in any way. 500 people laid off. Now, fortunately, they're furloughed typically, so they come with full income. As a matter of fact, many of them make more on furloughs than not. But still, you can imagine that lack of spending, that lack of revenue for the hospital, that dire budget situation at the hospital or the college or the city obviously is going to cause a lot of other decisions to be made that are going to prolong this recession for quite some time. So it is very concerning. We all want everybody to be able to get back to as close to a new normal as they can, as quickly as they can. Any other questions? Any questions for our finance committee?